Hello everyone, and welcome to our Chronic Healthcast series. This is the first of our series, and I'm Virginia Falcon. I'm the Global Head of Marketing for AXA Global Healthcare. And today we are going to be delving into a topic that particularly affects women all over the world, which is menopause. And to talk about the unique challenges faced by women with menopause, I'm joined by Dr. Nitisha Nahata. Dr. Nahata is a London-based general practitioner and medical educator with a keen interest in the fields of medical education, women's health and diabetes, and a clinician with extensive experience in supporting women through this transition. Welcome, Dr. Nitisha.
Thank you very much, Virginie. I'm very happy to be here.
It's our pleasure. It's our pleasure. Thank you for being our first guest. Now, without further ado, we will jump in on exploring this topic. And the first thing we'll do is to just understand a little bit what menopause looks like around the world, because it really differs by geography and where women are based. Interestingly, in terms of the prevalence of menopausal symptoms and their living conditions, we can see that we have about 74% of women in Europe that declare having symptoms, where, for instance, in Asia, it varies between 22 to 63%, which is really fascinating to look at these numbers and see the range. And we can see that menopause is really predicted to increase to affect about 1.2 billion women worldwide by 2030. So it certainly is a big topic and a vast number. And in 2021, women aged 50 and over accounted for 26% of all women. So it is certainly a growing topic. So can you give us a bit of an overview, Nitisha, on what menopause is?
Yes, absolutely, Virginie. Thanks for that intro. So menopause, as you can tell, is quite a prevalent problem, and it is the natural biological process where the woman's reproductive life comes to an end. Okay, so all women actually go through this. And it can be affected by a variety of factors. So the reason you see a difference in prevalence as well is because it can be people present or people kind of report it differently based on education, cultural backgrounds, religious factors, and even access to healthcare, which is especially important for women who are maybe not living in their home country. It's just to be aware that it's so different in lots of different countries. These can present some barriers as well for them.
And I mean, indeed, that makes complete sense. Cultural differences could play a significant role in how women would present or recognize the symptoms. And I suppose what would be some of the challenges that women would face during menopause, and how can they navigate these challenges, especially if they are, I suppose, living maybe in a country that's different to their home country, or traveling frequently?
Yeah, no, that's an excellent question. So, especially for people who are living abroad, who are living not in their home country, awareness, I would say, is the most important thing, and that itself can be quite a challenge, because maybe the information is not in their own language. There are barriers to even accessing healthcare. So if you're in a country where the physicians don't speak the same language, then that can be a difficulty. Also, like I'd already kind of mentioned, cultural factors. So in some countries, it's not really spoken about, menopause. So even, finding a doctor and presenting to them to talk about these things can be a bit challenging, or it can be a bit more difficult than in their home country. So yeah, these are the factors that can influence it. The Last thing is also, especially if you're traveling a lot, it can feel quite isolating, and you're away from kind of your support system or friends and family. So that can be another barrier, because we know that that in itself is quite important for menopausal women to have that support system that they can share with.
Yeah, absolutely, absolutely. And I was going to say, in terms of just more broadly, what menopause is all about, and for people who are listening or who will be watching this video as well, I think you have an overview. I think on maybe the next slide on how menopause or the different phases of menopause and how they present. I suppose it'd be great to hear a little bit from you on that. I'm sure a lot of people listening will be interested to hear how this all presents.
Absolutely. So these are two phrases that you hear quite a lot, perimenopause and menopause. So I've kind of divided it into kind of two very simple words. So climacteric, a lot of people might say as well, that essentially means perimenopausal. So that is the hormonal, physical, and psychological symptoms occurring at the end of the female reproductive life. So at this point, you start feeling that something is different. You start maybe feeling some symptoms, physical or mental health symptoms, but you're still having periods at this stage. So your periods might change. It might be that they become heavier or lighter or more irregular or more painful. Everyone's different, but you're still having periods, but you're just experiencing the symptoms, or you're kind of sensing something is different. Whereas menopausal, it's a very kind of clear diagnosis, is when you have no periods for at least a year. Okay, so that's a very clear thing. A lot of people also, you'll hear this term postmenopausal. I'm not a big fan of that phrase, because you're always postmenopausal. Once you've gone through the menopause, that's it. That's you for life. So I'd rather say you're menopausal. So you've gone through this for 12 months, and that's it.
That's really interesting. I have heard this term quite a lot. So really interesting to hear the details. And I suppose coming on to something that I'm sure a lot of people might have as questions or might be experiencing in these phases is the impact of all these changes on women's emotional well-being. I'm sure lots of hormonal changes do have an impact on well-being, emotions, and maybe perhaps if there are some unique challenges that maybe women who are again either expatriates or not living in their own home country might be facing with these.
Absolutely, yeah. So, coming on to the hormonal changes first, and then I'll address the emotional side just after that. So, there are three main hormones that we have to be aware of in when it comes to menopause. So, the first two are estrogen and progesterone, as we can see here. These are hormones made in the ovaries, and they're important for sexual and reproductive development in women, and also help with women's menstrual cycle. Now, I'm not going to go into too much detail, but you just see a nice kind of colourful picture here, just to see that it's actually the balance or the choreography between estrogen and progesterone that regulates our menstrual cycle, that tells us when to ovulate, but tells our body when to ovulate, etc. So that's why it's important. Testosterone is a hormone that is also made in the ovaries, but it's also made in the adrenal glands, which sit just above your kidneys. Now, this is important for sexual health, bone health, and women's estrogen production and energy levels. So very often there's a misconception that testosterone is, only the male hormone, and the man has testosterone and women have estrogen. But actually, all three hormones are found in both women and men to different degrees. And testosterone does play a very important role in women as well. So what actually happens in the perimenopause or the climacteric stage when you start feeling unwell? So women get older. So as you age, your estrogen levels produced by the ovaries, they start to fluctuate and they become unpredictable. So that's when I mentioned you get the irregular periods and the kind of the heaviness changes, etc. So because, it's not as regular as it used to be, the estrogen levels going up and down. And then eventually the estrogen, progesterone, and testosterone levels, the production diminishes. It is important to note here that ovaries continue to make testosterone even after estrogen production completely stops. And even though testosterone production from the adrenal glands, the glands just above the kidneys we talked about, it declines, but it still continues with menopause. That's why a lot of women, when we talk about treatment later, they don't actually need anything to do with testosterone, because actually your body is still producing a small amount. It's only a small subset of women that actually need, testosterone as treatment as well. So that's the reason why. Coming on to the symptoms. So this is a very busy slide. There's a lot of symptoms. Essentially, what my takeaway was, what I wanted to take home is for you to take home is that there are a lot of symptoms associated with menopause. There's not only, a couple or one body system that's affected. Almost every body system is affected, as you can see here. The most common one I'm sure everyone's heard of or experienced it is the hot flushes and sweats, mainly at night. That's about 74% of women. That's quite a high amount. But you can get anything from neurological symptoms like headaches, to dermatological symptoms like hair loss and brittle nails and things like that, to gynae symptoms and urinary symptoms like frequent UTIs. Estrogen also plays a very protective part in our body, so it protects the bones, and that's why you get this rapid kind of bone loss in the first 5 years following menopause, and also protects your heart. So the risk of cardiovascular disease actually increases after menopause, to make it almost equal to that of men. So estrogen could does quite a lot. But what have you not noticed? What have you noticed that's not on the slide, actually? So the invisible symptoms. So all the physical symptoms are there and they're very easily to depict. But what about the other side of menopause? So the tiredness, the irritability, emotional lability, depression, anxiety, brain fog. Very often, that is the main thing that really affects women and affects their quality of life. Very often, other than the hot flushes, etc., they can deal with the physical symptoms. It's this that really, affects their functioning in their day to day. And especially, you mentioned kind of women who are in countries that they don't, that's not their home country. This can be especially very debilitating because, again, a lot of things that help with this, so having a support system around, having an infrastructure that you're kind of aware of or that that is known to you in place, not having that can really kind of affect these symptoms as well. And most of these kind of symptoms, the evidence shows that things like lifestyle changes can help with it. So things like regular exercise, and eating healthy. So again, plant-based diet. You can have meat as well, but in kind of less quantities, and reducing alcohol, caffeine, and mindfulness as well has good evidence that helps with this kind of thing. So for people who are in countries that they don't live in, having access to that, knowing where to kind of get these things can be quite challenging. Just moving on, the symptoms of, I mentioned the two other hormones. So the progesterone symptoms are mainly the kind of irregular periods and kind of contributes to that side of things. And the symptoms of low testosterone, which, as I said, a subset of women have, is low libido, low energy, sex is less pleasurable. It can contribute to the brain fog and reduce energy as well. So sometimes that needs replacing.
Thank you very much for, I think, clarifying a lot of this. I think, just following on to this really good overview to understand both the symptoms, now we understand what some of the perhaps the help might be available, either in the form of a treatment, but also just in the form of, we talked about mental health support and various other things. I suppose, the main question I think was fascinating hearing you talk when you presented the symptoms, and I have spoken to some of my friends, and I think a lot of what happens as well is some of these symptoms are hard to pinpoint. A lot of them are probably common to lots of other things. You can be really tired for lots of other reasons, for instance, or irritable. So it comes back to, is there a test for menopause? How do we know that these symptoms are menopause? It could be anything else, and you don't want to be jumping on conclusion or asking for treatment. So yeah, how do we find out? How is this
Yes.
approached?
No, excellent question. It's actually one of the most common questions that I get in clinic as well. Is there a test for menopause? So there isn't an easy answer, I'm afraid. So menopause is primarily a clinical diagnosis. Now, the reason for this is the blood test that a lot of people talk about is something called two blood tests, FSH and LH, which are two hormones. Now, these are two hormones that are elevated when you are menopausal. So that's it only goes up when you are fully menopausal. So when you have symptoms, when you're experiencing symptoms, most likely people present when they're perimenopausal. In that case, the hormones will still be normal. They won't necessarily be elevated. So even if we do the test and it comes back normal, does that mean that it's not perimenopause? No, it doesn't, because you can still be perimenopausal. So there isn't, unfortunately, a very clear test to say, okay, you are perimenopausal type of thing. Those tests are done when, for example, if someone is very young, so I've put some ages on there, and we think, oh, this might be perimenopause and this isn't quite normal, then we can do those tests because sometimes they're kind of borderline elevated or something, and it tells us something is wrong. In terms of you saying, it could be something else, what are the other symptoms? So it's completely reasonable, and you should undergo tests to rule out any differential diagnoses. So, for example, if you're having hot flushes or feeling very hot, sometimes it's a thyroid issue. So it's completely reasonable to kind of check your thyroid function and say, oh, is it that? But there's no specific test to say, oh, it is definitely perimenopause, if you see what I mean. So it's more like you test for other things, you rule other things out, and if the symptoms kind of fit in the clinical picture, then it is most likely perimenopause.
That was really helpful. Thank you. And yes, unfortunately, no straightforward answer, but it's good to hear the options available. I suppose before we wrap up, and this is going to conclude our Healthcast today, but I think, as per this slide, coming back to our audience and what we're really interested in and caring about within AXA Global Healthcare, which is the woman who might be expatriates traveling often or not living in their primary home country. Any practical final tips or resources that you could share?
Yes, no, of course. So I've kind of put it on this slide as well. So information is my number one tip and takeaway. So actually, a recent paper in Nature that was published tells us that actually access, just information generally, access to the correct information and also misinformation is an independent determinant of health outcome. So just information, which was very baffling, actually. So that shows us how important it is to have access to the correct information. There's a lot out there about menopause. I wouldn't read every single forum that you can find, etc., because some things work for some women, some things work for other women. So it's not a copy paste. So I'd avoid those kind of places where it says, oh, you must be on this medication because it's the only one that works. Not quite true. So as we kind of mentioned previously, lots of different modalities, lots of different combinations of medications, and you have to work out what's right for you. I'd say the first thing is to inform yourself. These are some good websites, really excellent information sources. They've got some of them have videos online, fact sheets. You can email for advice and information, and especially for people, women who are abroad, who don't live in their home country. This is a great source for kind of to kind of educate themselves about menopause and about the different things that they can do themselves at home as well. And coming on to that, things you can do yourself at home. So it's things that I kind of alluded to before. A lot of it is lifestyle things that you can kind of have to alter a little bit to manage your symptoms. So a reduction in caffeine is absolutely recommended. Alcohol can exacerbate symptoms as well. Regular exercise has good evidence to help. So this is 30 minutes 5 times a week of moderate exercise is shown to help the menopause as well. And things like that sometimes this is a bit difficult for people who live in different countries, but support systems. So it's the kind of soft factors as well that actually can be quite beneficial. So if you have a good support system, people to talk through what you're going through, etc., that seems to alleviate symptoms as well. So those are the kind of 3 takeaways that I would mention.
Great. Thank you very much. I mean, I'm sure, no doubt, there might be for support systems. If you don't have your closed support system, there probably are in every country forums and maybe expat forums and people of your own country or nationality that are probably have been set up and could probably be places you can reach out to talk about symptoms and share maybe experiences with other people. So that might be an option. But thank you very much. That's really helpful, and thank you for leaving us with some resources as well. That's always great to know what to look for. So thank you so much, Nitisha, for all the information, shedding light on this subject as well. Certainly I've learned a lot. So and I'm sure it's been really helpful for our audience as well. Very clear as well, and so a few myths that have been debunked. So thank you, and thank you to our audiences for joining us on this Chronic Healthcast today. And hopefully you have found it really useful. There is support available if you need to reach out. And until next time, thank you very much, and tune in to our next Healthcast very soon. Thanks a lot, Nitisha.
Thank you.
Thank you.
Thank you
Bye.
so much, Virginie.
Goodbye.
Bye-bye.